I'm Fancy Nancy here with Bri, and we have a special guest, Dr. Jason, today.
I am not
Welcome.
a new mom, so I apologize.
Dr. Jason Nobles
That's right.
is here with us.
You have a nickname. I have a nickname. You just
Bri
go by
is
Bri.
That's all it needs.
Beautiful Bri.
Just Bri.
We could say the nickname apparently, but it's not camera appropriate.
We're trying to think of good nicknames for you, though, that start with a B. We'll think of something besides beautiful.
Good one with a B. Hey.
Yeah, brilliant. Anyway,
Yeah. Oh,
Dr.
yeah,
Jason,
that's what I was thinking.
Dr. Jason's here to talk about gestational diabetes today because it's a hot topic. And it happens. It happens. I mean, it's not like a thing that happens.
It happens.
It's so common. I don't actually know the statistics, but I do know that it happens.
1 in every person diagnosed with it has it. That's the statistics.
Whoa.
How do I
See, it's not just me. I'm not the only one who does it on our
That's
show.
usually you that does it.
Yes.
I was just going to watch for
Turn your
comments.
I feel
volume down.
vindicated.
Okay, I'll look at that too. But let's start at the beginning of gestational diabetes, which is at 24 weeks, you need to get tested and have a glucose test.
Yes.
What is the point of that, and should you do it?
Well, the point of it is to see if your body can handle the sugar load. It's supposed to be compared to before pregnancy as well.
Okay.
So it's kind of hard to tell what you're testing to compare to if you don't get tested beforehand.
Ooh.
But
didn't
the
even think of
purpose
that.
is really to drive up the sugar so high to see if the mom can actually handle it to get sugar back down to normal level.
So let's test it, push it to the
Yes.
limits,
Beyond the limits.
beyond the limits.
Because the equivalent of what's in that glucose test is the equivalent to the amount of glucose in 4 cans of Coke.
Yikes.
Now, a
And it's
healthy
really just like
person with
this
a
much.
great pancreas and a fantastic blood sugar maintenance should probably go above the gestational diabetes limit if they drink 4 cans of Coke. Just my
I
two
would be
cents.
a disaster.
And this drink is, and I shouldn't say I like sugar. I used to like
Everybody
sugar
likes
a
sugar.
lot. I mean, everybody likes sugar. But compared to having a Mountain Dew, this was sweet.
Like
I
4
did
Mountain
do
Dews.
the glucose test for all of my pregnancies. And it's only, I mean, it's not a ton of juice, but it's like
Straight
just
sugar.
it's straight, like syrup
Yeah.
almost. So did you do the drink? And
I did with Bella, I think. I don't remember.
you would assume so, though, because
would
with
assume
Bella,
so.
it was doing
So
whatever
with
they
the
tell you to do.
second one, they told me, we're going to do this. And me being me, I went, hold on. We're going to do what I research and decide is deemed necessary. And we talk a lot, Dr. Jason can expound upon this, but we talk a lot about fight or flight. So that not putting your body in fight or flight, especially when you're pregnant and carrying a little one. So you take somebody healthy, as I can be with my the last 2 pregnancies, not the
Right.
first. We all know how that one went. But my last 2 much more natural pregnancies, and if I would have taken that drink or drank 4 cans of Coke, I would have been a basket case. I would have been sick. I would have been miserable. But beyond that, I didn't want to drink the drink. So the is it pink now or whatever
I thought
it
it was
is?
orange.
It's orange.
I
Green
looked it
orange.
up.
It used to be green. Now
It's like Kool-Aid, right?
And
It's a
I haven't
juice.
seen it. All I know is they told me, we're going to do this at your next appointment. And I said, okay, no, we're probably not. But you're allowed to say that.
Yeah.
People are, what can you do? How do I not have to do this? I'm like, you tell them you're not going to. So
And that's it. They don't push back. They
I looked
don't-
it up.
I'm sure they
The
judge
main,
you.
one of the ingredients in it is brominated vegetable oil,
Okay.
BVO, also known as flame retardant.
Oh, yeah.
I was not going to drink flame retardant with a baby inside of me. I'm not going to do
No.
it in general. So that stopped the nurse flat in her tracks when I said, no, I'm not going to be doing this. Now, I had told my midwife I wasn't going to. She said, it wasn't just this dream of, they said, okay, then don't. I told her, it was researched.
Yeah.
And she said, well, we have to check with the OBGYN whether you have to do this or not. No, me being me, I'm going, I don't have to do anything.
Yeah,
I
right.
don't care if I fire you. I don't
True
have to
story.
do
Right.
anything.
Yeah.
That's a big thing for moms. They have to know they don't have to do anything. Might get CPS called on you, not for this instant, but you don't have to do anything. Here we
Right.
are surviving. But so I told her I'm not doing this, and my provider, the OB, actually said, have you eaten yet today? And I said, no. It's like 9 in the morning. I hadn't eaten yet. And she said, let's just do a fasting glucose. And then we'll bring you in again in 2 weeks. I did not have any concerns about it. my issues with sugar pressing, I feel healthy, so on and so forth. Now, you can maybe go into what that looks like. But, so she did a fasting glucose. She's like, it's fine. And she never brought it up again. So I would recommend, probably if people are nervous about it and it's going to drive their anxiety or their stress, to go back in and get that second one. I know you can do orange juice or Skittles. I wasn't going to eat Skittles. I've heard that. You can do the Skittles, bunch of dyes and sugar. I just said I'm not going. My body. I don't.
You don't want to.
I don't do this.
Put yourself through
so
that.
I'm not going to put myself through. I said I would do organic orange juice because I do that.
Yeah.
And she
So
said, let's just do a fasting glucose.
So if the glucose levels, or what are they measuring? Not glucose.
Glucose.
They're measuring glucose. So if those levels are high with fasting, does that mean that you're going to end up having gestational diabetes? Like, should you
'Cause
go in and get tested before you get pregnant to find out
Yeah.
where you're at?
You could have diabetes going into it, and you could not have diabetes while you were pregnant.
What?
I know, it sounds weird.
It sounds really complicated.
But
And
how many people have you talked to, moms particularly, love being pregnant because they feel so much better?
right.
That's their body's
that's
starting to
part of
function better because a whole bunch
That's
of
not
things
me.
going on change. That's not you. No, I know.
That's not you? You don't feel great when you're
I
pregnant?
didn't hate pregnancies, but it
Yeah.
definitely wasn't, oh my gosh, I feel better. All these symptoms
Yeah,
went away.
it wasn't you feel
But
good.
It's usually when you're sick.
I guess the part that I
Yeah.
think is weird is, like, skinny mom, you would assume, like, gestational diabetes, you should be, like, a bigger person if you're getting this diabetes, right? Is that mean to say? Sorry?
No,
not-
no, because you're
But I
thinking
mean,
of
I'm just
typical
assuming,
type 2
like-
diabetes
right.
onset comes with
Yeah,
the
so
obesity
I
and all
mean-
the other stuff. Sure.
A healthy mom can have gestational diabetes? Why? How?
Well, add into it, like she said, what else raises blood sugar? Stress. So if there's excess
Okay.
stress on the body, or if they're healthy but haven't really figured out that they have fatty liver or insulin resistance, because normal insulin levels aren't non-fatty liver insulin levels, to where you're not going to balance sugar properly whether or not you have diabetes going into it.
Okay.
So you could have normal blood sugar. I was talking to a woman this night. She always has normal blood sugar numbers, but her insulin is 5 times higher than it should be. But she wouldn't be considered diabetic because they don't look for the insulin. They're just looking for the sugar.
Okay, so why is it bad if your insulin is too high?
Well, for one, depends on what you're trying to do, but insulin causes growth of tissue, growth of fat cells, fat blocking. It causes increased storage of fats into the liver,
Okay.
which the liver is responsible for detoxifying the blood, and you don't want to be toxic when you're pregnant.
Pregnant. So that's where the concern comes in, where you have to pay attention to this when you're pregnant.
Well, just from the insulin level, that is. Now, the big thing with sugar, if there is gestational diabetes where the blood sugar is way too high, then the baby's blood sugar is going to go high. Then the baby's pancreas has to work in excess to produce more insulin while still developing.
Okay.
So now, am I correct? You do the drink, that comes back, then they do further testing. Is this one?
I
Well,
mean,
yes,
they have you
because
come
they do-
back
They
if
have you
it's
come
too
back
high or
and
something,
do
and then you
something
do like a
else to
longer
determine you
test.
have.
Yeah.
Yeah, because they test fasting, then they drink the drink, and then it's 1 hour after, and the number they're looking for is 190 after an hour to get down, if that tells you anything about how high that is. And
No,
then
it doesn't, because I don't know what's normal.
Normal, ideal fasting blood sugar is 75 to 85.
Okay, so 190 is high.
190 is massively high. And then
Okay.
3 hours after that, they want you back down closer to 100. So at 1 hour and the 3 hour mark, they want you to spike up that high and then come all the way back down. which
Because
is a
that means that
massive
it's all
stress.
processing normally.
It means your body is responding and producing the insulin and getting rid of it. Yes.
Okay, so you didn't do the drink,
I did not.
and
They
then
did
what?
a fasting glucose. That probably doesn't determine what they're wanting to determine. I've seen docs say, no, that doesn't determine if that's good or not.
Yeah.
Maybe it was based on my diet. They know that it would be a false read if I did have that much sugar, since I don't have sugar like that on the regular. But so we've determined there's other options. What happens when they come back and they do say it is gestational diabetes? What's the options now?
Well, it's funny. And I was looking around at those because from that aspect, what are they being told? And it's basically 4 things: lose weight,
Yeah, eat healthy. Right?
eat healthier and exercise, and don't miss your appointments.
Okay, so how is that doing anything?
Legitimately, that's on the Cleveland Clinic website.
Okay.
So that's don't miss your OB appointments is the fourth step in maintaining and managing your diabetes. But realistically, they want people to lose weight and be pregnant to manage their diabetes, and it's kind of silly. But the problem, there's so many problems confounded on this because they're never tested properly going into it, because sugar is a marker in and of itself that can be massively misrepresenting the entire spectrum of the body. But when you take into account the added stress of pregnancy with just the stress aspect of it, then do you eat a normal amount or do you eat more when you're pregnant?
You eat more.
I eat more.
So you're
Way
putting
more.
a ton more food in, you're creating more of an insulin demand on your body, and then you're also passing it along. So there's so many different aspects to look at, but if you're just looking at from what they would recommend they're trying to lower the blood sugar, so they would prescribe a medication called a glimiclamide. Glimiclamide?
We don't know if it's right or wrong, so
Sounds
you
good
can
to
say
us.
it however you want to say it.
Glimiclamide, which is an anti-diabetic drug, which its goal is to lower blood sugar, side effect being low blood sugar, of course. And then you have the excess toxic demand on the liver, crosses over the pancreas. What's it called? Placental barrier.
There you go.
And goes
oh
into
my
the baby.
God.
I don't know.
Right? Blood brain. But then everything that it's in the mom passes on to baby. So one of the main things that jumps out at me with this test is that if the baby's producing that much more insulin, it's going to put that much more stress on the pancreas as the baby develops, leading to more type 1 cases.
Which they say, I haven't looked. This is why I bring guests on, because if I have not had to deal with it firsthand, it's not something I've researched. I can talk for 800 hours about breastfeeding and C-section, but ask me about gestational diabetes and I go,
I don't know.
I've never looked into
Right.
it. So that's where, am I correct? And they say if it's not addressed and you do have gestational diabetes, what issues can come from that? Larger babies or something like that?
Well,
That's
so,
one of the
if
main
you-
ones is bigger babies.
So if you are diagnosed with it, you just need to start. I mean, you mentioned those 4 things that they want you to do, but really you need to watch what you eat. Like that's what they tell you, because I think my sister had it and some friends of mine have had it. And what do you need to do? Measure your insulin levels and not eat sugar?
Well, they're going to measure sugar levels.
Okay.
They're not going to measure insulin levels.
Okay.
That's where the disconnect kind of comes in, because it's insulin's job to deal with glucose, but it's
Okay.
never looked at. It's measured of
Right.
what's going on with the glucose, not what's supposed to help the glucose.
Got it. So
Right.
you're not getting to the underlying
Right.
piece of it.
Yep.
Okay.
And then the problem with it, one of the main problems is it's asymptomatic, really. I mean, a bit of fatigue, but most people are going to contribute that to I'm pregnant, I'm
pregnant,
making another
right.
human being, I
Which
should
is
be
why
tired.
they have it as a routine test now. So where do we stand? Do we need to do the routine test? If you assume you take a case like mine where I'm healthy beforehand, we tested me before I got pregnant, I've got a great diet, do you skip the test altogether? Do you routinely test everybody? What do you do?
Well, that's in the ideal situation where they've had the testing going into the pregnancy, they prepared the body for it, they've detoxified, they cleaned out the body. Then they go into it, the likelihood of it coming up is monumentally lower than average Joe Schmo off the street going and getting pregnant. They're going to be more likely to, because people eating the standard American diet already have some form of fatty liver and blood sugar regulation issues. That's why it's becoming more and more common, is because the food sucks.
So,
So can
people
you-
are unhealthy to start with,
Yeah,
and then
that's
they get
that's
it.
where it comes from.
Yeah.
So can you speak to mom that says, I didn't have it for my last 2, but I've had it for this one? Or is it super common to have it for all of them? What does that look like? Have you?
When you don't have it and then it develops, it's the same thing as function of the body deteriorating over time with the more abuse that we put it through. So while the first one came along, now when she goes in the second one, let's say, and she develops gestational diabetes, she's got more stressors in her life because one, she's got the first kid. Now she's trying to manage that and the new baby, and plus, if she's still eating the normal lifestyle that has excess sugar to begin with, she's going to have those issues.
Okay.
Wow. So Katie says, I'm dealing with it since week 14, and she's now 34 weeks. She's on metformin 2 times a day for it. Can you switch to Dr. Jason's
My
camera
face?
and zoom in?
So we've
But
addressed
legit, what do you do?
We've
I mean, what's
addressed
metformin? And
get adjusted.
Get adjusted?
Obviously.
Get
We've
meds?
addressed get tested, be healthy beforehand,
Yeah.
right? That was my goal with my pregnancy. And then you have those that I wasn't planning on getting pregnant, or
Yeah.
I didn't know anything about this, and now I just found the wellness way, or now I just found this, and I'm 15 weeks pregnant, or
Yeah.
5, or now
What do you do?
what are the options? Do you still test them just in case?
Sure.
We've talked about other options for testing. I would personally, do 4 or 5 organic sodas over this much of the brominated vegetable oil, because I'll take real cane sugar.
Yeah, to get tested.
Now, me, I wouldn't do it because my stuff is going to be off the wall, because I don't do sugar on the regular. My body's going to say, I have no idea what you put in.
Yep.
So,
What
but
is
take
that?
somebody who usually does it, I'll do that over the brominated vegetable oil, the real
Right.
cane sugar. So we've done the test. Now it comes back. Do they start by first managing diet, exercise, and all the appointments? And if that doesn't work, then they go to the metformin?
Metformin.
They should. I'll say it that way. They should.
Okay.
But most likely not. And the bad thing is metformin, for example, is there to help with insulin resistance and help speeding the insulin out of the blood. But if Katie can comment on there, did they test her sugar or insulin, or did they even test her insulin? Because I've heard that so many times where people are on metformin, even for PCOS or other issues, they just put them on metformin because it helps with insulin resistance. There are things that work better than that we have, but they're using drugs for things like that they never even test for. That's what drives me nuts.
Right.
Plus, there's the toxic load of the drug on the liver, which is going to increase
So what's
fatty liver.
worse? I mean, gestational diabetes or taking metformin when you're pregnant?
Taking metformin while you're pregnant.
Like, is that even
So
an
they
okay
need to
thing?
find somebody that can manage. They're here, they're pregnant. They need to find somebody that can manage it without the metformin.
Yeah.
Correct. And figure out how to, because diabetes can be reversed at any time, even while pregnant. It's a matter of figuring out what's driving the sugar up and then helping the body deal with it more efficiently so that it can eliminate it. But when you're pregnant, it's a scarier situation. And
So there's that fear that we've talked about before.
there's a
Adds
fear,
stress.
and you
Really
have
adds-
gestational diabetes
Yeah.
and your baby's going to be sick. Here, take this. It'll
Right.
help. It won't really help. It'll just change the numbers. It's not going to help her body function better to deal with the sugar naturally. She's going to need that medication now, unless after pregnancy it comes down.
So
Wow, that's
there's things
interesting.
you would do on. It's not just diet.
Correct.
We'd start there, like we always do.
Right.
But if that's not, and do routine testing on insulin, not blood sugar. Is that what I'm gaining?
Both.
Both. Okay. This is why I'm not a
Yeah.
doctor.
Right. I'm like,
We
I
do
know
that, and if
something
that
about
doesn't
kale.
work, you would go
That's what I
more.
know.
You would go more towards gymnema and different type of things like that,
Yeah.
depending on the person and their test
100%.
results.
Yeah, and it depends on where the misfiring lies. Is it not enough insulin? Is it too much insulin? Is it just massively high sugar swings to where the pancreas isn't able to handle load? Depending on what it is, kind of steers us towards that direction.
Okay.
So, and it might not even be a blood sugar pancreas issue, it might be a liver issue, which toxicity in it's just so much more common these days. And we always had that talk, sick mommies make sick babies.
That's Bella.
That's
my-
one of
our
where it
story.
starts, is the toxicity. And
Yeah.
insulin resistance triggers fatty liver disease, which leads to that whole cascade.
Because the liver is what deals with the toxicity.
Yep.
So all the pieces.
We've got a couple of good shorts out right now on liver and
Yep.
fatty liver
Yeah.
and toxicity.
Short
from
ones?
Insulin. Yeah.
Short.
Short
Are
45-minute ones?
Yeah. Short
Can
45
we
minute
call
videos.
them
Well,
short?
we do have a 5-minute
We
insulin
do.
resistance
We
one.
do. We do have a short,
Okay.
short. But I think that's because you did that one.
That's because I did that one.
That sounds right.
I had
That
a
sounds
timer.
like that's the one that you did.
Yep.
So to wrap it up, I learned something new, because I'm not one to get scared, because I live in this bubble. I like to call it my wellness way bubble.
Yep.
I've got a few docs in my back pocket. Oh, I've got this going on. What can I do?
Yeah.
In fact, one of those stories was when I was pregnant with Jace. I don't know if it was the friction from all the sit-ups you made me do at CrossFit
My fault, apparently.
or what, but I ended up with a large...
Yeah, it's from sit-ups.
Yeah, your fault. A large, it's not a
old-
cyst because you
The
cannot
old
see
raspberry
it.
in the butt. Yep.
Raspberry is a tennis ball. It was Anyway, and
Like your lower back, like
lower back,
tailbone?
Tailbone.
where your tailbone.
What-
Okay,
I mean, where you
crack
do
meets
sit-ups?
your back.
Yep.
Yeah.
Yeah, and I looked it up. I used to get every once in a while like pea size, and it would go away. Well, being pregnant, my immune
Yeah.
system being more taxed or tired or however you want to describe it, it had grown and grown and grown and grown and grown, and it was like this big, and you couldn't see it. It wasn't. I could just feel it excruciating. I couldn't walk, and I, of course.
Are
So
you
we went
laughing
in.
at her?
He just remembers the story. It was the whole Bree's
It's
butt
all
story.
come back
yeah.
to me.
So I went in to the fire department and medical
Yes,
doctors,
right.
hoping they could just like lacerate it, drain it, figure out. She goes, I don't think that's what this is.
Okay.
We're going to try a round of antibiotics. And I know me being me going, I have to get this figured out. I can't walk. And of course, at the time, I'm working here, and I went in and I talked to Doc, and he said, it was the do we try the antibiotics? What do we do from here? Hemming and hawing, and I said, well, there's a little. I hadn't told him yet. Remember, Kim and I were playing a game. How long I could I could not tell everybody when I was pregnant with Jace, because we do weird stuff like that.
We do.
Funny.
And I said, I'm pregnant, and of course, then it was, wait, what? You're pregnant? I didn't
Yeah.
know, but yeah,
Once
okay.
you got past
There's
the
no
shock.
antibiotics. We're not doing this. We're going to try something else. And we started with, I mean, yeah, did it take longer? Yeah, I was out for a week. I couldn't walk. I was not at work for a week. I probably could have
gosh.
taken an antibiotic and been back in 2 days,
Yeah.
one day. But between medicinal mushrooms and turmeric and echinacea and vitamin D, castor oil, anything I could find in the cupboard. People go, well, what fixed it? I don't know. Classic
know.
Brie. I took everything. I need to get rid of
It was a
it.
combination of everything.
Oh,
Don't
that
do
looks
that,
healthy.
though.
You want me to do that? Gone. Not had an issue with it since. But if I
It's
would have
because you don't
been,
do sit-ups anymore.
what are you implying?
I mean,
I do sit-ups once
You
a
do?
year. No,
when you need to sit up.
when I need to sit up.
But anyway, it's gone.
It's
You
gone.
don't-
It actually started to come back when I started working out again after I had Jace. We were back, Kim and I were back at the gym 2 weeks later, and I stopped sit-ups for a little while.
Yeah.
Got my body back to healthy, and did all my, we called them my butt supplements, because that's what we did.
Butt supplements.
Well, my husband would be like, it hurts, it's coming back. He's like, did you take your butt supplements? So, anyways,
Butt supplements.
there's our new show, Bri Tells
There you
All.
go.
There you go.
So, I did, and
Take
it was gone.
supplements to get a butt.
But,
To get a butt.
no squats. Anywho, we determined that it just goes to show there's other options out there.
Yes.
But fear leads people into not finding them. So they need
Well, and it's
to
easier. I
test.
mean, it's
If
just
you're not
easier.
pregnant yet, we need to do the right tests ahead of time. You need to get your nutrition in check, and you probably won't have any issues with this. If you are already pregnant, you need to find a Wellness Way doc that can that can work with the OBGYN, probably
Right, yeah.
ordering the tests, saying, okay, you've got an appointment in 2 weeks, go in, get this tested, bring it back, and we'll figure it out, starting with baseline diet, nutrition, and then if we have to, herbs, supplements,
And I mean, diet
and then
and
addressing
nutrition
that
is a
after
big.
the fact. How many moms have it, and then it goes away, and then 1, 2, 3, 6 years down the road, they're having issues with
Yeah.
X, Y, Z.
So I
All
mean,
the
could you just have gestational diabetes and then be fine after you have your baby?
Yeah.
What's the
So
definition
are you
of fine?
Are you really fine though? That's what I mean.
Well,
Are you
not
actually
medically
fine?
classified as diabetic. Yes, you can.
But
But-
because you had it, does that mean that you have some sort of something? Medical term?
Some sort of something.
Insulin resistance?
Insulin resistance, metabolic dysfunction,
Maybe?
anything
Okay.
along those lines. Absolutely. Yeah. And fine by. There'll be people in here all the time. They'll say, "Well, it doesn't matter. You have diabetes." And like, "Well, my blood sugar's fine." I was like, "You have diabetes. I'm
Yeah.
telling you, looking at your numbers, you have diabetes." They never told me that. I was like, "Well, it's right here, and this is why."
Yeah.
So it's something that the testing is so one-sided from the fire department standpoint that they're not looking at the whole picture. So it's hard to really get a picture of how to reverse it or stop it or get the diabetes or get the blood sugar regulation under control by looking through a keyhole at one little thing,
Right.
which is what they're doing.
So they just have, and actually Doc has said this even recently, They only know to look at what they're trained to look at. And we look at things so differently and think so differently that we're able to see those pieces and find those causes and actually address them.
Yeah.
You know, versus what I was going to say before is, well, it's diet and exercise. But what is diet? I mean, even that image, you know, for a doctor, for an OB to say, watch your diet, what are they telling you?
Well,
Follow
there was
the
a
food
list
pyramid?
of foods yes.
Really, though?
Because on the Cleveland Clinic website, then I was looking, and when it said eat healthier foods, the grains and
What?
all the things were listed on there as the healthier foods.
Which are sugar.
Yeah.
Which are sugar.
What
So what
happens if somebody's allergic to wheat and they say eat more
Yeah.
whole wheat? Well, not only are you causing inflammation,
Right.
but you're adding sugar.
Sugar, yeah, your sugar is still going to be.
And I've seen people just avoid food allergies and have blood sugars go from 200s down to right around 100. Not from changing anything else, just avoiding food allergies.
Talking
that
personal
big of a
experience here
stressor.
at all?
No,
No?
patient-wise.
But you do have, I
But
mean,
with your stuff,
but with your story. So what do you know about insulin resistance?
Nothing.
How do you know everything?
Well, I do. I know a lot of stuff. I'm not
Yeah.
insulin resistant, though. I developed type
No,
1 diabetes.
But I don't know the difference.
Type 2 is
So I'm just gonna call it
high blood sugar, high insulin, essentially. Right? Type
Okay.
1 diabetics, whether they're autoimmune or not, can't manage the blood sugar because the pancreas does not produce insulin.
Okay.
So there's not that response. You can eat sugar and the insulin stays here. Normal person, you eat sugar, insulin comes up, and then it clears out.
Okay.
Type 2 diabetics are both up here. Insulin resistance can be here, can be here, can be here, can be here, can be here.
So it can be all over.
so your
Yeah.
type 1 that you had developed is one that they typically say once you have it, you have it.
Correct.
And how many prescriptions do you take a day?
0.
Boom.
Mic drop. There you go.
Yeah.
But really, I mean, for the people that watch New Mom Monday or haven't seen what you do with your journey to weight loss, you used to have type 1 diabetes, right?
Type 2.
Type 2.
Type 2.
See, clearly I just missed all of that explanation. Did you just explain
I
all
thought
of
you
that?
said you developed type 1.
I did. From type 2.
What?
Years of chronic abuse
Oh.
leading to type 2 diabetes,
So you're special, you had both.
both.
It's extra special.
And it's
you
becoming
like
more and more
sugar?
common because of the gestational aspect. Kids are getting diabetes in the womb to where they can't handle it as they grow up and the pancreas can't handle it.
Oh,
That's why type
Another
1 is
mic
becoming
drop.
so much more common.
okay. That makes more sense then.
That and the other thing,
That and the other thing.
vaccines.
Oh, toxic overload all the way around.
Well, yeah.
It
it's
doesn't
just
matter.
Toxicity.
Well, the
And
number
then
one
what-
cause of type 1 is a viral attack on the pancreas.
So you have these little, just think, it's the perfect storm. You have
It's
a
all
mom
yeah.
who's got gestational diabetes, takes the metformin because she doesn't know any better,
Which gets to the baby.
which gets to the baby. So that liver, pancreas, one of them is taxed already,
Both.
inside, not to mention all the rest of the stuff that's taxed.
Right.
Comes out, is fed more toxins between iron
vaccines.
ventimal,
Right.
iron ventimal,
Environmental.
It's like, what's iron ventimal?
You don't know that
A
one?
certain type of formula or something?
environmental, formulas, vaccines,
Vaccines.
just air quality,
Anything,
so on and
everything.
so forth. Shampoos, and then
Yeah.
they end up with juvenile diabetes.
Which didn't used to happen until what age? Like, what was juvenile diabetes?
It
used to be called
adult onset.
Adult
Adult
onset.
Yeah, because in 1980 there were 0 new cases of adolescents.
Say that again.
0 new cases of type 2 diabetes in adolescents in 1980.
Yeah, and now instead of
2010,
calling
there
it
was over, like,
onset, it's
60,000.
juvenile.
And then we can't figure out why it's increasing.
Right.
I mean, we can.
So reverse engineer the whole thing.
Yeah.
Back to the mom, which
Yep.
back to sick moms make sick babies.
Yep.
I remember in grade school, there was a girl in my bus, and she had a little pack on her side.
Yep. And those are so much more common now.
I was saying now, I know a couple, and I'm
But
not
I'm
even
sure
in
they're
school.
more convenient and not as noticeable. So that these kids
They're
don't
like
have
sewn
to be
into the
judged.
the skin. They're like sewn into the arms and stuff.
I was
Yeah,
kind
it's
of kidding,
direct.
but it's really, I mean, that's true.
Yep.
Yeah, because it's more convenient to do that than
type
to
1
follow
pumps.
a different diet. or to understand or to learn what foods you should or shouldn't be eating. Because, I mean, people like...
But if your doctor's not trained to look at it that way, if your doctor's just
then you
trained
can't
to
blame
say,
them.
they're
That's
doing
true.
what they know.
That's true. You
I
can't blame
don't
them.
know anything else to fix this other than to give you this, so I'm going to save you from one, one thing, and which is how people end up on
It's a rabbit trail.
rabbit trail.
Yeah. So Carrie just joined. She said maybe we discussed this already, but she failed her first glucose test and passed the 3-hour one with flying colors. So it's just hit or miss depending on the day. I mean, there's something there that needs to be taken care of, but...
Well, the 3 hours is just 2 hours after that first fail. So she took it, and then 1 hour later, her sugar was too high, and then at the 3-hour mark, then it came back down.
Is there one that they do where you take it and then you do another one again, or no?
A lot of times they'll have you come back for a completely another time to redo it again. Yeah.
Yeah.
So she failed the first one. Look at me. I
So
would
if she
fail.
failed and
I'd
then-
fail the first one. They'd say, "You're an unhealthy individual. You cannot." Of course I can't. My body does not have any idea what to do with this.
Most people
And-
should fail that test with the amount of sugar that's in there.
Because your pancreas shouldn't be able to handle it?
Correct. You shouldn't
Or
be
your
so
liver.
accustomed.
Am I right? Was it
Shouldn't be so
pancreas?
accustomed and
Not liver.
trained to doing that.
Right.
Okay.
Your body should freak out with that much.
Right. Wow.
I mean, just picture if you ate the
I'm-
amount of Skittles now that you did before you found
I would be
us.
sick.
But back in the day, I mean,
I mean, I
I
didn't know any
remember-
different.
so you know maraschino
Well, so
cherries.
my body, I mean, at that point, didn't know any different either then, right? It was just like, yeah, I can handle that much sugar.
Well, it couldn't.
It,
But you're daring
clearly,
it to.
Clearly it couldn't.
yeah.
Yeah. Yeah.
Touche.
Awesome.
Good
And if
point.
you want to
It
pass the
couldn't.
test, I would recommend doing the orange juice or something like that because there's not as much glucose in it. So it won't spike up the glucose. It's straight fructose. So it'll just stress out the liver and the blood sugar shouldn't raise
Which
that
is
much.
why there's docs out there that say it's not the same, it doesn't work. They're right when they say that. Still doesn't mean I have to do that test
Right.
or drink that drink.
Right. Yeah, you don't have to do it.
Don't drink the Kool-Aid.
Don't drink the
Don't
Kool-Aid.
literally don't drink the Kool-Aid because it's not Kool-Aid. I mean, some people might think Kool-Aid's fine,
Right.
but it's
It's the
not.
bucket.
It's what did you say it is? Flame retardant.
Flame retardant.
Mm-hmm.
It's the bucket. Baby
the
gets
bucket.
brominated vegetable oil. Baby gets
the
this.
bucket.
Mom was
Drop, drop,
unhealthy
drop.
before
That's
you
right.
start. You know, people say, well, what caused Bella to have anxiety?
these
What causes her to
issues, yeah.
have acne? It's not just one
Mm-hmm.
thing. It's the bucket. And then they're 15 months or 15 years and people go,
Mm-hmm.
how did this happen?
Yeah.
One thing after another.
It doesn't just happen.
Doesn't
That's
just
how it
happen.
happens. It doesn't just happen.
Yep. So we talked about there's
Years-
never going to be a
years
cure
on
for
years.
cancer because there's so many things that come along. You can't take a pill and make them all go away.
Well, this has been depressing. I
But
mean,
enlightening
slightly-
and empowering.
I mean,
Come on,
it is
Nancy.
slightly like, man, that's crazy. There's so much that we're doing wrong. But there are
There's
things you can
answers.
do. Yeah, there are answers.
There's
you just have to
answers.
find the people who think differently about it so that they're not, because
you
they're
have to
always
say,
gonna,
I disagree.
you have to. Yeah.
Hashtag I disagree. I
Yeah.
disagree that I have to take metformin. I disagree that I have to take that brominated vegetable oil.
Yeah.
Flame retardant.
Flame retardant.
BBO, whatever you want to call it.
Yes.
And I know they're trying to make ones that are taking it out of it, but it's besides the point. I don't
It's
want
still
that
too much for your body
huge
to handle.
amount thrown at me, my body, my baby.
Yeah, especially while pregnant.
Yeah.
My body, my baby. That works. It does.
My body, my baby.
I mean, you
Awesome.
could hashtag it.
We were talking
Oh,
about
what's-
hashtag I disagree.
Yes.
But if you haven't seen that, we'll post that in the comments.
Mm-hmm.
We've got our big I Disagree event coming up in May. I've seen a couple of
We
books
do.
getting people. Oh, we've got it posted already. Look at that. For the giveaway, for the big giveaway that we're doing, you can't win.
Yes.
Sorry. You're not eligible.
You are not eligible.
Not fair.
But thank you, Dr. Jason. That
Yeah,
was-
thanks for being
My
on the
pleasure.
show. It was excellent.
I learned something. I don't
I
know
learned
everything.
a lot of things. I don't know a lot of
Mission
things.
accomplished.
Yeah. So
So-
I'm not going to keep drinking sugar. And for people who are out there that do have gestational diabetes, hopefully this was helpful. And find a Wellness Way clinic near you to get some of the answers that you're looking for
Yeah,
and
they'll work
a
with
different
your-
approach.
Yeah, it's neat for me is to find out it's not too far. It's not, oh, I'm 20 weeks already.
It's not too late.
It's not too
yeah.
late.
Yep. Yeah.
There's so you don't have to stay on the meds and all that.
Right. Like I said, the medication's not going to help the body function better as it's trying to do other stuff like make another human being. So
It's no easy task for the human body.
not.
What do we have coming up next week?
I was going to ask you the same.
Oh yeah.
Home birth is in 2 weeks.
Brianna is really organized and she emailed both of us.
Just now?
Start
Ooh,
somewhere.
start somewhere. Hey!
Right. It's
we
not too
kinda
late.
just talked about
Just start
it.
somewhere.
There you go.
Hashtag start somewhere.
Yeah. Yeah.
Hashtag, we said a lot of
talk
hashtags
about
today.
some-
Are you supposed to say hashtag
And next
out loud?
week at this time will
don't
be
think so.
Sydney's 7th
Hashtag-
birthday. She won't be able to be on the show. She'll be at school, but just throwing that out there.
Oh.
But another
I
hashtag
mean,
start somewhere. You
really?
guys weren't as healthy as you were when you had Sid.
Nope. Sydney versus Caden. There's two drastically different blueprints going into
really?
those two. Hmm.
Yeah.
Oh, I didn't know that.
Yep.
Can we take her out of school for her birthday? Bring her on the show?
I'm
feed her
sure if you
cupcakes?
ask her mother,
Good cupcakes.
that's what I think we're picking those up for her school.
Happy Valleys.
Mm-hmm.
Excellent. Alrighty, so start somewhere next week. Monday is going to be all about new mom
Starting somewhere.
starting somewhere.
Yeah.
Just do something. All right, so we'll see you next week.
Bye, guys.